This week is Brain Awareness Week. How well do you know your brain? Yeah. Have you been fair to your brain? This organ works every day from the very first day you step or you're giving birth to. Yeah. Your brain starts working. Even in your mother's womb, the brain is working. So have you been fair to this particular organ? Understanding brain health, myths, facts, and everyday impact. With me here in the studio to talk about this, yeah, I have Dr. Oderinde K.O., consultant, addiction psychiatrics, University of Benin Teaching Hospital. Yeah, I think you're here in the studio, right? Interesting. Doc, welcome.
Thank you for having me.
Yeah, so when I get to about psychiatry, be like, I know they called before, but they say we should go there for medical checkup all the time. Yeah. It's good to have you in the studio, Doc.
It's a pleasure.
All right. And join us virtually is Professor Imonde Henry, Professor of Clinical Psychology, Ambrose Ali University, Ekpoma. Prof, it's good to have you join us.
It's a pleasure being with you.
All right.
Good day, viewers.
All right, pleasure is all mine, Prof. And we have Dr. Precious Etiosa Ikpo, Head Medical Laboratory Services, FNPH, Benin, and Biorisk Expert. So you guys are all doc. Don't worry.
Yes, thank you for having me.
I'll go and train to be a doc also. Everything will be balanced. All right, let me start off from the personnel I have with me here in the studio. Dr. Derinde, consultant addiction psychiatric. I mean, the brain. That's what majorly psychiatry is all about, isn't it? People would like to know just a brief definition of that organ, the brain. People are like, oh, it's the brain. What is the brain really, Doc? Let's start from there.
All right. Thank you for having me again. And I must commend your background about that vital organ called the brain. The brain is just like a powerful computer, and it's an organ in the system, in the body, that helps us to think, to remember, and to learn information. And of course, in the brain, there are several parts, several regions, and all of them work together. Most times, the brain receives information from our senses, processes the information, and send the signals to organs in the body to respond. And of course, we are here to emphasize the need to take care of our brains, because when you have a healthy brain, you'll be able to function optimally. You are here because your brain is healthy. I'm here because my brain is healthy. So that's, I think that's what I will say about the brain for now.
All right. Well, people are like saying that, you keep saying our brain is healthy in Nigeria because of the harsh economic reality. Some of the people that is impacted negatively on the brain. Well, let me come to Dr. Precious Etiosa. Now, what do you have to say about the environmental impact on our brain, especially people that are here in this climate, Nigeria? You know what I'm talking about? The hardship, the situation, and all that. How can one really cope? How can the brain cope?
Okay, I'm going to speak as a medical laboratory scientist and a biorisk professional, that's biological safety professional. Our environment, we have a lot of sanitary issues because maybe poverty and the rest, and lack of awareness on how to take care of the brain, the need for laboratory investigations for early detection of infectious diseases or monitoring of nutritional status of individuals, because the brain thrives on good nutrition, and infections and other issues can affect the brain health. So in our environment, people are really not aware on how to take care of their brain. They need to do regular checkups. They need to take care of their environment so they will not have infections that can affect the brain. So as a med lab scientist and a biological risk expert, we encourage people, when you start having some symptoms that are persistent, you should see a specialist. You should see a doctor. they will guide you better. So we will not have issues that will cause more problems in the future.
So you mean the brain needs to be checked on?
Of course, you need to take care of yourself.
All right. Well, I'll come back to both of you on that. Let's move over to Professor Imode Harry. Prof, I believe you can hear me. She talked about nutrition of the brain. And the brain, they say, is a very vital organ that works right from conception till the day we stop breathing. I mean, talking about nutrition, talking about regular check of the brain, Nigerians don't really have this notion. They just feel that you can only go for medical checkup when someone just loses it. Maybe when someone just gets mad, that is when you start going up and down for medical checkup. Aside this, are there any other aspects where one can just go out there to just check on the brain?
Good morning once more. Certainly, there are. My colleague in the studio has spoken from the MedLab perspective. I will be speaking from the psychologist perspective. In other words, I want to start from the fact that even as it is now, a lot of people find it difficult to go check if they have some problems in the brain. The brain is a vital organ, like my brother have said over there. It is used for remembering, thinking, and for critical decisions that come across what you ought to do. But you will not be able to think cognitively. Your emotions may not run properly. You may not be able to convey exact message to the next person close to you if there are defects in your brain. Therefore, for us to be able to communicate effectively, for us to be able to behave in such a way that people around will see us as someone who is effectively communicating, who is effectively relating, who shows some signs of emotions and concern, we must learn to attend to our brain. But why is it that a lot of us shy away from going to check our brain? Because we feel that those who go to the psychiatric hospital, those who see the psychologists, they are all mad. Using that word in quote, because that is not in the dictionary of psychologists to use the word mad. But however, maybe as we begin to go, we'll throw more light on this. Stigmatization will affect people from going to check their brain. Let me stop there for now so that we'll pick up the...
Thanks a lot, Prof. I will come back to you. Stigmatization, that is another point. Once they get to see one going towards a psychiatric hospital, the first thing that crosses the mind of an average Nigerian is, he has gone mad. So how can that be checked? So can those people to go out there to really check on the brain?
Well, let me say that someone who struggles with mental illness or who has a psychiatric illness is just like any other person who has a medical illness. Just like if you are hypertensive, you want to see your cardiologist. If you are diabetic, you want to see your endocrinologist. So same way, if you have a mental health challenge or an emotional health problem, you should be free to see your psychiatrist. In Western world, when people have a mental breakdown, even just a mild distress, they say it, you know, with their shoulders up. Say, I want to see my mental physician. So I think the government and all stakeholders need to put up a template so as to destigmatize mental illness. And again, even in our workplace, when you see someone who has a mental health distress, you know, most employers may have some, you know, reservations. Yes, and because if you are diabetic, people go and they get employed. They won't say because you are diabetic, you won't be employed. But someone has a mental health problem, you see all those reservations, the stereotypes, and the discrimination. So I think to curb that stigma, the government needs to do a lot, you know, in that regard. You know, because in fact, to me, mental health is the crux of our health. Yes. Because you and I, if we are not mentally stable, mentally healthy, we can't sit down together. We can't understand each other. Sometimes even a market woman was speaking with me some days ago. He said, doctor, this your mental health, it is the most vital part of health. Yes. So it's, and of course, even not just the government, even religious institutions, churches, mosques, the clergy, we need to put hands together to destigmatize the myths about mental illnesses.
All right, so it's not a crime for one to go to a psychiatric hospital for mental evaluation.
Yeah.
It doesn't mean the person has gone mad.
No, absolutely not.
Because you call
in fact, permit me, let me, that is because psychiatric illnesses are in several levels.
Yeah.
Yes. You don't need to be broken down so severely, you know, because the ones people see on the streets, so when they hear about mental illness or mental hospital, they think, okay, that's the kind of issue that individual has. Anxiety disorders, they are mental health condition as well. Depression is a mental health condition. Someone who has maybe post-traumatic stress disorder is a mental health condition. So it's in levels. And the good news is that all levels of mental health distress are treatable. An individual can function optimally. We have several neuroscientists who sometimes, maybe even people in the academia or people in science who sometimes have schizophrenia. And they even won the Nobel Prize award at some point. So mental illness is not a limiting factor. It's not something that, okay, when you have it, your potentials and your talents will be suppressed. No, it is not.
Easy for you to say anyway.
Absolutely.
Easy for you to say, Doc. Because we have instances whereby,
yes.
Look, I know this nurse. She's mentally deranged. Don't even come near me. That'll be the work person, like, you know, telling us, I know you are good, but sometimes is that stigmatization?
Yes,
or
you are.
Just be careful.
No.
May I come in? Is it,
briefly.
Okay.
Yeah.
I'm talking from the position of experience, what I've seen. I have clients, individuals who sometimes have mental health distress. They were treated in the hospital, and they recover and they function well. I'm not talking theory here. I'm talking evidence-based medicine. Yes.
All right. I'll come back to you, Doc. Now let's talk about addiction. So much really affects one's mental health and, of course, the brain, like, you know, addiction, maybe drugs or kind of a character. You just, let me tend to, like, you know, affect the brain negatively. Take a look at the teenagers, the youths of nowadays. You get to hear drugs like colos, codeine, tramadol, Igbo, you just name it. How does that really impact the brain?
I may not be able to talk so much on addiction because my area is mostly on investigations, monitoring, and the likes. But with my experience in mental health for almost 2 decades, I've seen a lot of young persons' activities, functionalities affected by these addictions. They have even seen cases where they are not able to go back to school properly, continue their education and the rest. So the place of this awareness program and seeing professionals in ensuring that people are aware of the negativity associated with getting involved in these substances cannot be overemphasized. And that's the reason why the Brain Awareness Week is very key, is very important, so that individuals can hear the myths around the brain and the stigmatization around mental illness and all that, and how to take care of the brain. This program this awareness intend to help individuals get this information so they take proper care of themselves. Even parents, they can guide their children. Don't go here, these drugs can this, they can that. We even hear these days a lot of young people have several combinations of these substances that sometimes in the lab, you can't even sometimes detect some of these combinations. So we will not rely on the psychiatrists, the psychologists, combination diagnosis to be able to ascertain what exactly the issues are and how to manage patients. So the need for more awareness cannot be overemphasized.
Okay, let's move straight down to where Prof is, Prof Henry. Now, we talked about stigmatization, talked about the use of substances that affects the brain negatively. Dr. Dorinde said that if one is treated properly, he or she might recover and start functioning properly. But do you think in a society like ours, we should risk that? They're going to ask the question. Madam said that is stigmatization. Now, what's your view on this?
Stigmatization is stigmatization. There is no two ways about it. Let me give you an example. A lady who has just been treated of having depression is back home, and she has a little store in the front of her house. And the next morning, she opened her store to begin to live her life the normal way. And the woman next door instructed the children and the family not to go there and buy something, that woman is mad. That is purely stigmatization. It is not a matter of being careful at all. Because as at that point, the lady had come back. She is sane, she is working, and she has come back to her business. Inability of others to assist will actually affect the treatment. And this will lead to relapse. Because at that point in time, she feels shrinking, she feels rejected, she feels ostracized because of the comments she hears from people, because of the way people treat her, and the fact that her little business is not moving because she knows within her that this is the saying around the place that that woman is not normal. Please don't go. The next thing you see is that she will be back to hospital. Therefore, it is on this basis that this sensitization we are doing now, it's very germane, so that people will learn to accept those who have gone for treatments, they are effectively functioning, accept them back, integrate them into the society, help them to recuperate, and help them to live a healthy, normal life. By stigmatizing them, you are actually pushing them back to the aim. Doc, are you with me?
You. Yes. All right. Well, he said stigmatization, borrowing for what you said, if one says they don't go to XYZ because of a mental condition, even after treatment, that is pure stigmatization. So you guys, you've heard it. Don't say because he or she went for a mental evaluation, you saw him or her acting weird, they were taken to either Selu, psychiatric hospital, and of course treatment is like, you know, perfectly done, recovered, only to come back to say, please accept me, you're telling him or her no, and because of fear of the unknown, that is stigmatization. Will you blame them? Will you blame them? Because we're not being careful here.
Yeah. Well, I may not blame them because of lack of understanding. Our people in this environment, in African setting, we still know, we don't understand what is mental health or brain health. Even those who are educated, people who go to school, who you think this individual is educated enough to understand the concept of brain health. So, in response to your question, those out there who may be reluctant to accepting people who were treated and integrated into the society, I want to attribute that to lack of understanding, and about lack of understanding about mental health. And this lack of understanding about mental health is not just within those who are illiterate or those who are uneducated. This mental health illiteracy is also very rooted among the educated elites. And that's why our being here is to educate our viewers so that they have a better understanding of mental health. Yes. because, as I said earlier, someone who has a mental health distress is just like someone who has a hypertensive crisis, who has a diabetic crisis. They all fall within medical problems. Yes. It's just that someone who has a mental health distress is seen by a psychiatrist. Someone who has a diabetic crisis is seen by a diabetologist. But all of these symptoms as a result of affectation in our body organs. So I think our viewers or people out there should know that the fact that Mr. A has a mental health distress doesn't mean that Mr. A cannot come back again to the community and live and function with others. It is treatable, as I said earlier.
Treatable.
It is treatable.
Okay, fine.
Yes.
Yeah.
And, you know, because when someone has a mental health distress, it's just the chemicals in the brain that are distorted. There is an imbalance in the brain chemicals. There are chemicals in our brain that help us to know, to perceive our environment, to think. Now, if those brain chemicals are distorted, if there's an imbalance, I may begin to see your cap, now you wore a blue cap, I may begin to see it as red or white. Yes. But by the time such an individual comes to the hospital and is treated pharmacologically using medications, psychologically using the psychological interventions, and of course the laboratory scientists also, they also come in, assess their blood system for perhaps any drug use. Yeah. So by the time we work together and in that setting, such individual will function. Yes. I'm saying this passionately because of what I have seen.
Because from what I've seen also, you see people say, okay, we've gone to the hospital, we are back, he or she is okay. All of a sudden, one night, disaster will just strike. How will you really defend that? Are you blaming the people for staying clear of such a person that has this mental health issue that led to him or her becoming so violent? Because that's what happens sometimes. Over to you.
You know, we may not be able to go deep into mental health, the causes and the rest.
Yes.
I know he's a psychiatrist.
Yes.
But there are a lot of factors that can cause,
that can trigger
it. From the biological aspects, you know, infectious diseases can actually trigger it. And so when these things are discovered, then the professionals will help to handle. Malaria can trigger all these meningitis and the rest. They can trigger even untreated syphilis, typhoid, and the rest.
Can trigger mental
so you
health
can see, because in our community, I said at the beginning, there's a poverty, there's lack of awareness, there is no proper sanitary maintenance and the rest. So those things that are triggers, apart from the other fundamental issues that causes mental health issues, but there are triggers in our environment. There are triggers in the person's life or whatever that can bring about these issues. So that is why the awareness is important. That is why when you start seeing symptoms, that maybe symptoms that seem not to be getting okay, fever, confusion, you know,
anxiety, depression.
The thing you should do is to quickly take the person to professional. And if they tell you, do this, do that, you should do it. You have, when you come to a mental health facility, for example, you will see a psychiatrist, you will see a psychologist, you will see a med lab scientist, you will see a social worker, you will see an occupational therapist. All these is to ensure that the patient has complete and total care.
You mentioned psychology,
a lot of persons,
because as you're mentioning this personality, these professionals, do you know what I'm calculating here? The money. The money. The money.
Health is wealth.
Let's go to Professor Henry. Right. Prof, as it stands right now, Medicare is so high in Nigeria because of, you know, the economic realities. Now, what would you advise Nigerians to do with regards to taking care of their brain that takes care of the body as regard with economic situation?
The very best thing to do, the first, is to be at peace with yourself. When you are at peace with yourself, you avoid stressful situations that will trigger whatever mental problem that you have that will affect your brain. Secondly, individuals, whether adolescents, whether adults, should avoid the use of substance, specifically alcohol and the other codeines and the rest that we have mentioned. Because you may be enjoying in some few hours, and in the next hour, you are tilted to the other side of the world. And once you are tilted, you have no choice that time to be able to cover the money to take care of yourself. And quickly, let me also add to the discourse that was on before my own question, that when we're talking about the mental health problem, it is not all mental health situations that there are violence. But because individuals are not so much educated or sensitized, they begin to see all mental health problems. Using the example you gave, the individual came back from the hospital, and after a while, there's a trigger. You have to run away. Why? You don't run away. If there's trigger, it's either his ways are relatively weird or not as normal as you would have expected it. That does not make that individual violent. That does not make him very aggressive. It is not in all forms of mental problem that you find these forms of aggression and violence. So we must learn to understand the different types of mental problem to be able to curtail. Yes, if an individual is violent, nobody will stop you from running so that you protect yourself from any harm. And not just only protecting yourself from harm, you also have to find a way to protect the patient from harm. You must learn the harm reduction process and every other thing. So for me, my take is we must flee from those. Madam has mentioned so many of the environmental situations, even economic factors, socioeconomic factors, lack of job. Even when you have a job, the pay is not enough. And you have myriads of activities to plug in that little pay that is coming to you. Is going to trigger stress. And when you are not able to cope effectively with stress, you certainly will break down. So don't use your hand. We agree there are those that are inborn, in other words, that we inherited, that are predisposed. But don't use your hand to be able to trigger those things that are lying low within you. If you live a normal life, a peaceful life, you will live clean, as the saying goes. But if eventually it comes up, we should not run away from them. We should learn to help them to recover.
So during the day, you give your last line on this discussion because Pokon, have other guests in the studio for all that discussion. People like saying that aside alcohol, aside drugs, there are some things that are beneficial to the brain in form of diet. So what do you think Nigerians should really feast on to really take care of the brain?
All right, fine. Thank you for that question. There is a direct connection between what you eat and your brain health. It's the gut or the stomach and the brain. They are like two friends that communicate, with each other. Now, in response to your question, foods like fish is quite is rich in omega-3 fatty acids, which help to improve memory, yes, and cognitive function. Even leafy vegetables, things like palm oil, but of course the palm oil should be not excessive intake of palm oil, because palm oil itself also contains saturated fats, which may affect the brain cells. So, but foods such as fish, in fact, I often advise my patient, okay, at least take fish at least twice a week, yes, to improve your cognitive function. And adequate intake of vegetables, fruits, and of course, take enough time to sleep as well. Yes, ensure that you have a routine bedtime, at least at least have about 7 to 8 hours sleep, because when you sleep well, it has a positive impact on your brain health. Exercise as well also is important, because when you exercise, it releases some chemicals, the endorphins, that help regulate your mood. Even those people who are depressed, we often advise them, do exercise, so that when you exercise, some brain chemicals will be released that will regulate your mood. Yeah. So I think by and large, if our viewers can engage in, exercise, eat balanced diet, sleep well, and take enough leafy vegetables, fruits, that will go a long way to improve their brain health.
All right, thank you so much, Dr. Durinde. I really appreciate you. Well, Dr. Precious, right? So, so what can you say to Nigerians going through a lot? You know that Nigerians are going through, you get to hear a comment, I pray Nigeria should not happen to you because of what the people are going through. How can I really cope in terms of maintaining a stable mental health? Briefly.
Okay, you heard the prof saying a while ago that first of all, you should be at peace with yourself. There are a number of things we cannot change as human beings. So be at peace with yourself. Gather knowledge, gather information. Like he talked about nutrition, then prof talked about the things you should do for yourself so that you don't have a relapse or so that you don't have relapse. So Nigerians, we are already in this situation. I'm aware that this is the situation. What are the little things that I can do to improve my situation? I will improve. Those I cannot change, I will be at peace with myself. When there's a need for me to see a professional, I shouldn't shy away from it. When I started working in mental health facility about almost 20 years ago, somebody saw me and said, you working? Festival say you will not be talking to me again. A lot of things, There's no way you have an issue. You feel that you are having some emotional things that you can't understand yourself. Seek professional guidance. Seek to see a psychiatrist. Seek to see a psychologist. When there's a need for you to run investigation, because infectious diseases can cause a lot of things also, seek guidance. And as Nigerians, we know how to survive.
All right, we know how to survive.
We know how to survive.
We are Nigerians. Yeah. All right, well, Prof. Henry, let's get to your last line for quality wrap on this particular segment, taking care of the brain. What's your last thought on this particular discussion?
Mental health is not a death sentence. Mental health does not ostracize people. Please learn to accept them. Learn to help individuals. All of us have some mental challenges. Even our ability to decide which kind of color of car we wish to buy can lead to some stressors that will trigger some problems with us, or even the type of woman or man we wish to marry. So please, let's help those and understand them in their times of need. Thank you.
Well, this mental health week, you understand, so you can go to maybe neuropsychiatric hospital to get awareness. Maybe you just have one or two things.
I have something to say.
Oh, really?
University of Benin Teaching Hospital. You have a mental department there at University of Benin Teaching Hospital.
Oh, really? So it's a meaning if I feel somehow right now, I should go to that place and to be checked.
And apart from that, this week is very special because the international, there are some organizations in the world that research and give awareness program and celebrate brain awareness. International Brain Research Organization, IBRO, Dana Foundation, Saint Drive, and Nigeria Psychological Association, Edo State. This week we decided that let's bring knowledge about brain health to our local community. So we have a whole lot of programs this week. We are going to have market outreach. We are going to have school hall programs. So
thank you.
It's going to be nice.
Thank you so much. Well, you've heard them. It's all about mental health. Be fair to your brain. That was the first question I asked. With the way you live your life, with what you drink, with what you eat, with the activities you get involved in or with.
how does it affect your brain? It's all about mental health, because if you're stressing your brain directly or indirectly, how can you really withstand the harsh economic reality of the country? Watch yourself so that you will not lead to a mental breakdown, okay? And if this is someone has been recovering, trying to recover, don't stigmatize, all right? Encourage that person. Let he or she know that you are there for him or her, all right? Just take care of them. Avoid their triggers. Don't be afraid, okay? Thank you so much, Dr. Durinde. Thank you so much, Dr. Precious. Of course, Professor Henry, I really appreciate all of you. Do well with your brain today. Take care of it.